Welcome back to Middlesex Moments, coming to you from Middlesex Community College. I'm Steve Minkler, the college CEO. The Community Health Center is a private nonprofit agency with the mission of providing primary care and social services to everybody, particularly those who cannot gain access to such services elsewhere. And I'm really delighted to have joining me today is Yvette Highsmith-Francis, who's the Regional Vice President of CHC. Thanks for joining me today, Yvette.
My pleasure, Steve. Thank you so much for having me.
Now, CHC really is one of these fundamental institutions in the city of Middletown, isn't it? And you've been with the CHC for quite some time now.
I have. And yes, the health center got its start in Middletown in May of 1972. We are now a statewide organization and so have a presence in 15 different cities or towns across the state, and then are also delivering some form of school-based health services in almost 200 schools across the state of Connecticut. But really all of it began in Middletown. Our founder and CEO, Mark Maselli, was a young man who was a community activist and who had heard from the community that access to affordable quality health services for Middletown's residents was challenging, and really worked to do something about that, and was mentored by two legends from Middletown, Reba Moses and Jerry Weitzman, who really served and supported the work of the health center until their lives ended. And so it really is an institution in Middletown. And I'm born and raised in Middletown, and so a product of the Middletown community, and kind of grew up knowing about the work of the health center, left Middletown, went away to college out of state, and came home young and sort of employed but uninsured, and was able to get my health services for a couple years through the health center. And then a few years later, found myself working for the health center and doing exactly what I came home to do. I came back to Middletown because I wanted to work in and serve the community that had sewed into me. And the mission of the health center aligned with my own personal and professional mission. And it's really what has kept me there for 26 years, is that as we have grown tremendously as an organization, we're still really rooted in the premise that healthcare is a right and not a privilege.
And I think, like you said, it also speaks a lot about what the Middletown community is all about. I mean, just we pitch in and help each other, and it's like having a big family. Just someone's in need, we're right there. Right.
Absolutely.
Now, you've been a big part of the growth of Community Health Center in your time at the center, right? You've helped launch a couple of the other locations throughout the state.
Yeah, I have been incredibly fortunate to be a part of the team that has done that. And, Steve, when I joined the health center in 1994, I never imagined that I was going to get to do some of the work that I've been able to do. And so was able to be a part of opening our location in Enfield, and then Bristol and Waterbury, and our most recent location in Hartford, a very large pediatric only practice that we acquired from Connecticut Children's. So yeah, I have been a part of that. And even really before that, as the health center was doing, really innovative work, was just a part of the team that went out in communities very early in my career at the health center. And this stands to date. Anytime we open a location in a new community, we go out and we knock on doors and we talk to people. We get to know the residents of the community. We introduce ourselves in a way that in the last 7 months, we can't imagine what that's like, right? Going and knocking on somebody's door. But that's how we, bring our services to a community, and how we learn. And so it's been invaluable for me to really have those interactions with the communities that we serve in that capacity.
Absolutely. And you're talking about the last 7 months. I think none of us would have thought that we'd be dealing with a worldwide pandemic, and no matter what our job is. So it's got to be more important than ever for a community health center to be there to help people in need at this point with COVID testing and all the other great things that you're doing.
Yes, absolutely. So we've started a whole new element of our business, which is COVID testing. And to date, we've probably done, almost 65,000 COVID tests, Steve, across the state,
Wow.
and are continuing to really be a part of the state's initiative to make sure that every Connecticut resident has access to COVID testing. So our testing is at no cost. We test all ages, and you do not need to be symptomatic. We just test everyone. And the testing is drive up, walk up, and we have 13 of our locations that are doing testing, but then we also do these pop-up events, and the information about all of them is available on our website. But also parallel to that, the work that we do, pre-COVID and in the midst of COVID is providing access to quality health services. And so we made a pivot back in March to telehealth and being able to deliver care via telehealth. And so remotely taking care of patients by video visits or by phone visits, and really not having there be any break in our patients being able to access their primary care team.
Mm-hmm. And this has really caused us, like you're just suggesting, new ways of doing healthcare and other ways of doing business. So it may actually be a little easier for someone to see a doctor or a nurse in need.
Yeah, it's something we've been advocating for years, that, if you had private insurance, you could probably do a televisit with your provider. Before, the bulk of the patients that we serve are communities most vulnerable, largely because they're living in poverty and are either underinsured or uninsured, didn't have that same opportunity, didn't have that same, the payer required that you be seen in person for you to get your health care. But now we're seeing that we've removed so many barriers. We've removed the barrier of time. We've removed the barrier of transportation and scheduling. And we're hearing from our patients that they like it. And they hope that even when we find ourselves, well beyond this pandemic of COVID, that we're able to maintain that ability to provide care to them.
So let's talk a little bit about, aside from COVID, some of the other initiatives of the Community Health Center. I mean, first of all, you got a beautiful new building that opened in Middletown in the last couple of years. But I think that represents, finally some space that is that is deserving of the services that Community Health Center provides to the residents. So if I were someone who really needed the services, I just walk into the Community Health Center and say, "Hey, I'm not feeling well. How can I get some help here?" Is it really that simple?
Yeah, it is that simple as walking in or calling us. And so you can call and schedule an appointment. And we are still doing some in-person visits. So we do have patients who do need to be seen in person. So we've got a core team of clinicians that are there every day providing care to patients who need to be seen in person. And it is really as simple as that, just calling or walking in, you get established as a patient. If you are an individual who doesn't have insurance coverage, we have staff members, we call them Access to Care, who are trained to walk you through the benefit assessment process. And so they really, walk that individual through that process. There are a lot of people who are eligible for publicly funded benefits and don't know it. And so we make sure that you go through that process, because we can discount our service. So if someone needs to pay out of pocket, we're able to give a 3-tiered discount based on your income and family size. But unfortunately, that discount doesn't follow you to the pharmacy, for example, or that discount doesn't follow you if you need some type of diagnostic imaging that we don't provide. So it's really important to get insurance coverage if you're eligible for it, so that comprehensively your health services can be covered.
Right. So with all these changes in our healthcare system, this must be a great opportunity for people who are looking for careers in medical care and healthcare. How is this changing, in some ways, your hiring model at Community Health Center?
Mm-hmm. So it has become incredibly nimble and responsive, and primarily because we are doing, as I stated, lots of testing around COVID. And so we are bringing in a whole new workforce to stand up that book of business for us. We do have many of our existing health center employees that are staffing that. We redeployed our entire dental team that can't deliver dentistry in the midst of the COVID precautionary measures to supporting some element of our COVID testing. But we need more people. And so we have these wonderful opportunities for people who are looking for temporary work, some up to full-time and even some reduced time opportunities. And so we really encourage you, anyone who's listening that's looking for, if you want to be a part of the solution in this pandemic, to really connecting with us around this, it is incredibly fulfilling work. And it's so important. I think there are lots of people who were really young when we experienced the tragedy of 9/11. But here we are today, where we have an opportunity, where we know that we're in the midst of a global pandemic and public health crisis, and there's great opportunity to support and be employed.
So it's time now actually for a quick break. So when we come back, more with Yvette Highsmith-Francis from the Community Health Center. You're listening to Middlesex Moments, coming to you from Middlesex Community College.
Feel like the pandemic put your life on hold? In times of uncertainty, Middlesex Community College is your way forward. With several degree, transfer, and career path options, your goals are not on hold. Stay close to home. Save thousands on tuition. Discover a classroom as unique as you. At MxCC, you'll receive a high-quality and affordable education with flexible scheduling. Find the perfect path at Middlesex. MxCC is your way forward. Register now.
Welcome back to Middlesex Moments, coming to you from Middlesex Community College. I'm Steve Minkler, College CEO, and I've been speaking with Yvette Highsmith-Francis, who is a Regional Vice President of Community Health Center, and she oversees the eastern region of all of its locations throughout the state of Connecticut. And Yvette's been with Community Health Center. You're now in your 26th year, correct?
I am, yes.
So what were you doing before coming to the Community Health Center? What's your educational background, and were you working before CHC?
Mm-hmm. Yep. So I did actually have one job before CHC. I like to joke now that I've been at the health center so long. I say I started there when I was like 5 years old, but I was a little older than that. So as I said before, I'm from Middletown, so I graduated from Middletown High School and went away to Long Island University in New York to get my undergrad degree in psychology. And came back, and my first job after college was with the Connection Inc. So I have an affinity for private nonprofits, and I worked for the Connection for about 3.5 years before I joined the health center and worked with them in their outpatient substance abuse work. So I was a licensed drug and alcohol counselor for the 3.5 years that I was with the Connection. And so really started my career providing direct services. And then when I joined the health center, my first role was as a medical social worker. And so I worked alongside with our medical providers in supporting it. Today we call it social determinants of health. We didn't call it that back then in the early 90s, mm-hmm. But I was kind of like a patient navigator and really addressed social determinants of health. So I worked in the community. Most of my visits were in people's homes or, meeting them somewhere in the community. It was really that space in between their healthcare visits. So if a medical provider had someone who was not following through on kind of their treatment as prescribed, or who identified they were having some challenges around housing or food security or, benefit application process, just sort of everything. Mm-hmm. And so I really had, again, I feel like that was so valuable in kind of informing the work that I do today as an executive leader, just really having an understanding of the more comprehensive challenges that impact our health, and ensuring that the health center is a healthcare system that really incorporates that. And so now it's much more formalized, and we have social determinant of health screening embedded in all of the work that we do. But in the mid-90s, it wasn't so much of that. And then I spent a significant portion of my career with the health center doing our HIV and AIDS work. And so really it was the beginning of the HIV and AIDS pandemic. And I transitioned from doing the social work to running our Oasis Wellness Center, which was a drop-in center providing education and support to individuals and families that were impacted by HIV and AIDS. And then I overseed our entire department and helped that really expand to where we had integrated HIV services in all of our sites across the state at that time. And that's been handed off to a wonderful, incredible woman, Casey Harding, who has evolved that into our Center for Key Populations now. So I'm really happy to see that early stage work has just really blossomed into some powerful work we're doing across the state and nationally as well.
Sure. So it sounds like some of the early work you did, maybe I'm getting the phrasing wrong, but it sounds like an intensive, intrusive case management style of healthcare.
It was.
Yeah,
yep.
yeah.
And it was intensive and sometimes maybe intrusive.
Right.
But yeah, absolutely. Really it was very high touch in the sense of very individualized. I would do kind of a care plan with everyone that I worked with and identify, the things that they wanted me to support them with and partnered with them in addressing those. And being from Middletown, being from the community and coming from a well-known large family. And, there were pros and cons to that. The pros were that I was a known entity in the community. Yep. So I, was the youngest of 6 children, single parent family, lived in local, Middletown housing development, knew the community. And it because of that, I think it was a trusted face in the community and really an extension of the work that Mark and the team at the health center had already established around really being a part of the community, not just there serving the community, but really being a part of the community. And so I found that has really helped. And as my career expanded and I moved from Middletown to my next community was New Britain. A lot of the same. I wasn't from New Britain, but I quickly became, a trusted partner of the community in New Britain, because when you are person-centered and, really lead as a servant, I think that is welcomed and received by communities.
Yeah, I think people respect the authenticity that you bring if you are a servant leader and you treat people with the dignity and the respect that they deserve. Absolutely.
Yeah.
So let's talk a little bit about what else you do in the community besides your role as a vice president at Community Health Center. I know you're involved with several organizations. Talk a little bit about what else you do in the community.
Sure. So I am pretty involved civically, surprising. I mean, the work that I do at the health center, especially now, really takes up a lot of time. But I was raised in a family that was absolutely committed to service and to civic engagement and involvement. And so I serve on a few boards. I've scaled that back a bit, but I am on the board of directors for the United Way. I am also on the Community Advisory Board for the Connecticut Health Foundation. I am a 2009 graduate of the Connecticut Health Foundation's Fellows Program. And so really my passion is around eradicating racial and ethnic health disparities. And so really ensuring that we have a healthcare system and that we have a society that is equitable and just. And so that we can move away from hearing, people of color have higher prevalence of every chronic illness. We need to address the why behind that. We need to be addressing poverty. And one of the things I'm the most proud of the work that the health center has done over the years is that everyone who works for us gets paid a livable wage. And so our starting salary, no matter what your role is in the organization, you don't make any less than $18.50 an hour. And, when you can move people out of poverty and being a first generation removed from poverty, I can speak to that. You change the entire trajectory for families. And so important that folks are able to do valuable work, but also be paid, in a way that they can pay their rent and that they can have a vehicle and that they can have food on the table that's healthy, and have opportunities to enjoy their life in their community, and that they can transition to some type of wealth, which is home ownership, initially. But you can't do that if people are having to, work 2, 3, and 4 jobs just to make their ends meet. And so really now as I am becoming a little more seasoned in my life, I'm very selective about where to put my energy in terms of making sure that it is with organizations that are really looking at addressing systemic change.
And, I think of all the things that have happened in the year 2020, this is the moment where we're finally having discussions and can finally take some action on these things. Like you said, it's been part of the mission of Community Health Center for many years, and being an agent of social change, and to really speak to everything you were just talking about. And yes, let's finally get some movement on this.
Yeah. And, a big piece of it is what you are doing, Steve, education, right? Mm-hmm. And so really ensuring that, everyone has access to advanced educational opportunities, and that we are, communicating with our young people in elementary school and really planting that seed that there is a pathway for higher education, and here's the opportunity for higher education. Mm-hmm. That was a seed that was planted in me by my mother, who only had an 11th grade education. You wouldn't know it if you were in the room with her, but she needed to drop out of school at 11, in the 11th grade to be able to support her family. And so her commitment was that wouldn't be the course for any of her children. And so while I was the first to go on to higher ed, she just said, you are going to go to school. And so it was never a choice, but it was really so important, right, in terms of what the quality of life is and what opportunities are available. And so, we want to make sure that regardless of family history or resources or lack thereof, that every young person knows that school is available to them, and every person who maybe is, a little further in their journey in life also knows that education is an opportunity that's available to them.
Right. Yeah, I think we definitely agree that it's a fundamental right for someone to have an education, which then unlocks the fundamental right to have a good, well-paying job. And regardless of the first two, you have a fundamental right to good health care in our society.
Yeah. They're all intersectionally connected.
Absolutely. So in a minute or two that we have left, Yvette, what do you do for fun when you're not volunteering in the community or doing your job at Community Health Center?
What did I do pre-COVID? Travel,
travel,
theater, live music, reading. Well, now I can still do lots of reading, and I can travel virtually. But yeah, I'm a mom of 4, mm-hmm. And my youngest is a senior in high school, and so my free time is still shuttling him around. But I'm also a minister, and so I love serving in that capacity. And I have a beautiful extended family that just they're the wind beneath my wings.
That's beautiful. Wow. Well, I want to thank you so much for joining me today, Yvette Highsmith-Francis, Regional Vice President of Community Health Center. Thank you for joining me.
My pleasure. Thank you for having me, Steve.
Thanks. And I want to thank our media partners, WLIS, WMRD Radio, for all the help that they give us here at Middlesex Community College in presenting Middlesex Moments to all of you. So thank you again to our listeners for listening to Middlesex Moments. And as always, you're welcome to visit us in person if you wear a mask. And our main campus is located at 100 Training Hill Road in Middletown. Or you can visit us at our Meriden Center located at Platt High School, where we have classes in the afternoons and evenings 4 days a week. And certainly visit us online 24/7 at mxcc.edu. For everybody at Middlesex Community College, I'm Steve Minkler. Please be safe and be well.